The World Health Organization said on Tuesday that the outbreak of monkeypox cases outside of Africa can be contained with more governments saying that they would launch limited vaccinations to combat rising infections of the virus.
But the important thing right now is to realize that this outbreak can be contained.
The World Health Organization said the new global outbreak of monkeypox, while unusual, can be contained with contact tracing and isolation. At a press briefing Tuesday, the WHO's Dr. Rosamund Lewis said there are over 250 confirmed and suspected cases of monkeypox in at least 16 countries.
This is an emerging disease. It has been emerging for the last 20, 30 years. It's not unknown. It's very well described. But we have a new situation of this emerging disease, which has now appeared and begun to spread among population groups which normally would not have this.
Monkeypox is a usually mild viral infection that is endemic in parts of West and Central Africa, and until the recent outbreak has only rarely been seen in other parts of the world. Symptoms include fever and a distinctive bumpy rash. Professor Jimmy Whitworth teaches at the London School of Hygiene and Tropical Medicine.
Monkeypox is spread through close contacts. So that means touching somebody or being exposed to their bedding or sharing utensils in some way.
The majority of the recent cases have been reported in Europe, the continent's largest outbreak ever, according to Germany, which recommends that those with the illness or exposed to it isolate for 21 days. Cases have also been detected in the U.S., Canada, Australia, and the United Arab Emirates. Dr. Lewis said that many, but not all of the cases have been reported in men who have sex with men, most in their 30s.
We don't know yet that this is a sexually transmitted infection. What we've described, as described earlier, that skin-to-skin contact is the primary mode, and we don't yet have the information as to whether this would be transmitted through body fluids, for example.
There are vaccines for monkeypox, also used to prevent smallpox, targeted for those who may be at risk. Germany has ordered 40,000 doses in case an outbreak there becomes more severe. France, Denmark, and Britain are also offering a limited number of shots to those exposed.
And to discuss this, I'm joined live from Bath in England by Dr. Bharat Pankhania, who's a senior clinical lecturer at the University of Exeter Medical School and an expert in communicable disease control. Dr. Pankhania, thank you so much for joining us again here today on ANews. It looks like we have a broadening of opportunity to learn of your expertise after discussing the COVID-19 pandemic for the last 2 years now. Monkeypox is something which is growing in our consciousness. Just an hour or so ago, I see that Northern Ireland was added to the list of countries where this infection has been discovered. What can you tell us about it? And particularly, I know it's not a new illness, but about how it is appearing in so many places around the world at this moment.
It's always a pleasure to discuss these infectious diseases with you, Andy. So, with respect to monkeypox, straight on the back of COVID pandemic, no wonder it is raising a lot of international interest and, of course, concern. So what has happened is there has been someone or some persons infectious, originating from West or Central Africa, who have probably met up with a lot of other people in another part of the world. And then, because everyone is susceptible, they have picked up this infection and then gone on to infect other people in other parts of the world. This is not a sexually transmitted infection. This is both a zoonotic, meaning animal to humans. So if you have an infectious an infectious animal, maybe rats or maybe a monkey, and then you handle them or their meat or something like that, you can get infected by them. And also by human to human transmission close contact with humans, close contact with their bedding, or close personal contact in the early phase of their illness. And then mostly the good news is most people go on to make a full recovery. Younger age group people are more affected and may be severely ill, but most people don't need any interventions to make them better. So the management is symptomatic depending on how they are. It is very itchy. It can lead to scarring, especially if you were to scratch those pustules and introduce secondary infection into them.
Just to pick up on that, obviously the name monkeypox is a very, itself is a very evocative name. I mean, we're familiar with other poxes. Shakespeare used it as a curse, did he not? A pox on you. So the name itself is very emotive. Also, we got throwbacks to the connections perhaps with smallpox, which I know was eradicated, officially declared gone in 1980 by the World Health Organization. So that was a very good thing. So there's that fear that is this something new that's going to replace smallpox, and we've seen the pictures of how disturbing that looks. But at the other end of the scale, there's chickenpox, which is a very well-known illness in most families, certainly in the Western world. So how does monkeypox fit in that sort of chickenpox, smallpox spectrum as something to be accepted as something which isn't going to cause too much harm and something that's really going to be very disfiguring?
I totally understand, and it's a great opportunity to reassure our listeners and viewers. So let's go. So right. Smallpox and monkeypox are of the similar pox family of viruses. And as you said correctly, smallpox was eliminated in 1980. I was one of the last persons, or last few thousand persons on planet Earth to get smallpox.
Really?
I had smallpox in 1972, and whilst I'm here, I have got a few scars. They're well hidden, but I have got a few scars around that area.
I don't know if I should congratulate you.
Well, it is good to be alive and lucky
Absolutely.
to be alive, and it is the power of vaccines.
And we're grateful for that.
Because I was vaccinated as a little boy, and the vaccines obviously prevented a more severe form of the illness, and here I am sharing stuff with you and your viewers. So monkeypox isn't in the same category as smallpox, right, in that usually it has been confined to West and Central Africa, and we haven't had global pandemics or global outbreaks of monkeypox. And therefore, there isn't that need for, we now need to eliminate monkeypox from planet Earth as well. And by the way, the word monkeypox has got nothing to do with monkeys. It is called monkeypox because in a laboratory, monkeys which had been kept captive for experiments were exposed to infectious prairie dogs. So these are little mammals. Mm-hmm. And these little mammals infected the monkeys. The monkeys got the pox, and hence the name monkeypox. Nothing else to do with monkeys. But we know how to manage it. And as your report said, the vaccinia vaccine that is used for smallpox can also be used for monkeypox, and it gives sufficient protection. Chickenpox, on the other hand, is something completely different, a different category of viruses. And chickenpox in early childhood is usually a self-limiting illness. Young children get ill, get better, and that's it. You don't want to have, this is really important, you do not want to have chickenpox as an adult, where the infection can be a lot more severe. Right. So early chickenpox in childhood is very good, and as older adults, as a result of having had that chickenpox in childhood, we sometimes get shingles. Right. So shingles is a manifestation, a recurrence of the old chickenpox virus that we picked up as a child.
So the name itself, as you say, it doesn't give us any indication of the level of fear that we should have. Because and this is something also very interesting. Has the media overreacted to this? I mean, at the moment there are 250 cases confirmed that I know of around the world. Maybe there's more. Partly that's because they're being identified, because a lot of work is being put into to label the cases so that they can be brought under control. What does this tell us about the importance of having systems where we can identify problems as they are developing and deal with them straight away?
Again, this is a terrific question, Andy, because I think it is always good for the media not to brush these things under the carpet. So it is a case of inform, advise, educate, and the people know and people learn about these outbreaks. And it clearly shows monkeypox is introduced into a susceptible population and bang, a lot of people get infected. And that's how communicable diseases go. So it's good to have discussed this. And sorry, I forgot the second part of your question, Andy.
The question of having the systems in place, the medical systems in place, so that researchers can identify and deal with the problem.
Yes, and again, it shows to us as clear can be that we've had the COVID pandemic, and we went along managing it essentially as we wanted to in our own country. In other words, we looked after ourselves. And the recurrence of monkeypox is telling us we need to work collaboratively. We need to work together. We need to work in partnership. So we need that international body, whether it is WHO or its replacement or its strengthened organization. I hope it is a strengthened WHO, whereby we have the monitoring, the surveillance, the action, the containment, the supply of vaccines, the delivery of vaccine, the taking of vaccines, all coordinated globally to help everyone on planet Earth. So it is, again, a warning signal that we must work together. We cannot work in isolation.
Now, one of the advantages of having such dedicated people as yourself and other researchers and doctors looking at the many different viruses that exist, and I think it is fair to say there are a lot more than just a handful that roll off our tongues, many of which are ones which, as I've referred to earlier, have very frightening connotations attached to them, including Ebola, which I know that you've also done a lot of work with. But is it the case that we're able to identify more existing viruses, or are more viruses coming into the human population because of our activities in different environments?
Very important issue. So, of course, we have the armamentum and the tools to rapidly identify viruses these days. So we have this wonderful technology called PCR. And you see, once upon a time, you used to try and grow the virus. And growing it is a hit and miss thing. You tried to look at it under the electron microscope. Again, it's a hit and miss thing. And then comes PCR. And with PCR technology, we can rapidly, quickly, efficiently, all over the world, identify these new things very, very quickly. So that's really good. The second bit is, of course, we will see more of it. So in the last few years, when we had the Brazilian Olympics, as you remember, we had the incidence of Zika infection causing microcephaly, small heads, and other issues with newly born babies. So Zika virus spread by mosquitoes, causing the Zika syndrome in newborns. Now we got dengue fever from bats to mosquitoes to humans. And we got MERS in the Middle East respiratory syndrome still there. So there is more of these things. And unfortunately, Andy, we will see a lot more of this because of man's activities. And man's activities are as follows: deforestation, climate change, rising temperatures, population growth, easy transport. So what used to happen once upon a time in the center of Africa stayed in the center of Africa. Now we're cutting down forests, we're living with animals, we're doing things to animals that we shouldn't be doing, we're eating animals that we shouldn't be eating, and we've got global warming, and we've got transportation. So expect problems. Another reason why we should work collaboratively to do all that prevention work. Prevention is cheaper, prevention is safer, prevention is much better.
And this, of course, was a message that we've been hearing from you for the last 2 years about COVID. Prevention, prevention, prevention. With that in mind, should, in terms of whether it's COVID or monkeypox or some virus that we don't yet know the special name of, what should we as humanity be doing to prevent? You just mentioned being careful in our environments, but for individuals, what should we be doing?
I think education is power, and with education being power, it's not only I'm educated, but as an educated person, you make sure that you elect and select better politicians who do the right thing globally. So the climate change issue is an imminent danger, and we really need to also work with politicians to support the poorer nations. Because if the poor nation has got no resources, it will cut down their forests. If it has no food, it will start eating animals that it was not normally eating. So, and then you will get your Ebolas and your monkeypox, etc. So we need good order politicians to recognize that I need to help all these other countries. Otherwise, their problems will become my problems.
Now, one of the interesting things to come out of the coronavirus pandemic, the COVID-19 pandemic, is just the sheer level of statistics. We've been bombarded day by day by day with numbers for different things, with R numbers, with infection numbers, with testing numbers, this. So there's tremendous amount of data, of factual evidence of how things have differed around the world. And to our shame, we saw with COVID-19 that the African continent was largely left out of protection. Even now, the vaccination rates there, for various reasons, are extremely low. But one of the positive things to come out of that pandemic has been the development, of course, or the continued development of the rDNA vaccines. And to an extent, the sharing of knowledge into, for example, the African continent, the sharing of knowledge amongst medical professionals around the world. How important is that in the coming years? And of course, how important is it that the wealthier nations back that up with some funding to help it develop?
So the European Union is doing great work with regards to strengthening the ability of the WHO to do its job, which is very good. There were clear failures with the vaccines in that the pandemic preparedness and implementation plan clearly said if and when vaccines become available, they would be shared across the globe with the highest risk group immunized first, with healthcare workers, and then other groups and other groups and other groups together. Whereas what we did and what we saw was United States said, I'm going to buy up 1 billion, 2 billion, 3 billion worth of doses. European Union did the same, UK did the same, and so on, and Africa got left behind. In the meantime, the mRNA technology, the platform of vaccines, were found to be very successful, and we can see the success here, Andy. Look at it, look at it, look at it, look at it. The evidence is here for us. The Pfizers, the Modernas, the AstraZeneca, Oxford vaccines for COVID are good. They do their job. They're very good. Compare that with what is used in China at present, and their efficacy is not so good, and they get the cases, they get the outbreaks, and then they have to have the lockdowns, which is regrettable. So now that we know that these vaccines are there and work, we will prevent other infectious diseases by using this technology. So I expect better vaccines for TB, maybe influenza, maybe other infectious diseases, and as a result, mankind will be better off for the technology that has been invented.
Well, that brings great hope for us. We should always have hope for the future. Just in the short term, monkeypox, is it going to stay around with us? Is the summer going to bring greater connections with people and probably the possibility of a further surge? Or is it going to pack up its bags and clear off?
So I expect, especially the richer nations, to be able to contain it, manage it, and it becomes it came and it went issue. But it is a warning sign. It is a warning sign that these things are waiting for you, and you need to improve your surveillance, your containment, your prevention measures. Otherwise, these things that are hidden in the deepest forests of Africa and elsewhere, Amazon, etc., will come and bite us, especially with global warming. So I expect, on the subject of monkeypox, provided it is done properly, for it to come and for it to go.
Well, Dr. Pankhania, I want to thank you so much for joining us today and giving us such a broad analysis. And I think that people should listen back again to all that you just said, because you've covered several points in great deal. I want to thank you so much for joining us again here today on ANews. Thank you.
My pleasure. Thank you.